All right, next, Ahmad with Anu Litho, and I'll give you the clicker, let you introduce it.
Very much. Hello, everyone. I'm Imad Aga. I'm a professor at the University of Dayton, and I'm also the founder of Nabu Optical Systems, which is basically a company that is specializing in the field of photolithography and nanomanufacturing. So today there's a pressing need in our society for nanomanufacturing or manufacturing at the nanoscale. It comes into our cell phones, into our virtual reality devices, even into digital health and medical care. Now, in any of these products that you see on the market or in hospitals, agility is key. And what is agility? Well, it means how quickly can you come up with a design and bring it to market, basically, in the cheapest and the fastest way possible. So that starts from a design. You fabricate your design, you scale up that fabrication or manufacturing, and you end up at the product stage. And then all that data is flowing back and forth. So you design something, you try to fabricate it, maybe it fails, there's an issue, there's a problem, you have to come back to the design, etc., etc., etc. So the workflow of nanomanufacturing is very complicated and time-consuming. So let's take the case of Proteus Health basically as a prototype of this issue. Proteus Health is actually a pioneering company that was founded a few years ago in the field of ingestible tablets or ingestible digital chips for tracking medical adherence in patients. Now, Proteus Health was tapping into a $2 billion market. And in fact, the company was so successful in fundraising that they raised up to $400 million in investments. Now, the chip they came out with, or the digital pill, was a very complicated design. It involved multiple fabrication steps to bring it basically from the design all the way to put it in the pill format. And to do that, what they did is actually they used a commercial foundry stepper scanner service. So these are your big foundries that implement things for your Apples, your AMDs, your Intels, etc., etc. And that foundry dedicated a small time slot for them, maybe 24 wafers, and that was sufficient for them to test on 5,000 patients in a year. Now, what is the problem here? The problem is that these commercial foundries have the necessary tools to scale up production and manufacturing, but they don't favor the little guy. They don't favor small, innovative startups. They favor the big players that are going to pay a lot of money. So what went wrong with Proteus Health? Well, Proteus chips actually involved a combination of in-house fabrication. A lot was done in-house, but then IC design was outsourced, and ultimately fabrication was done in this big commercial foundry. So if you think about that flow chart of fabrication, there were very long production cycles, more than 1 year to produce one batch of pills and millions of dollars for each run. So the company was burning cash like mad. Eventually, in September 2020, the company filed for bankruptcy. And while the smart pill technology was very valid and viable, unfortunately, it was not at a sufficiently low price point. Now, what is the problem? The key problem was that there was no solution available for that company that would have in-sourced or basically in-house the full production cycle. So what was needed was a fabrication system that had the yield that is available in these commercial foundries, but at a price point and flexibility of basically systems we might find in universities. Now, that's a difference between $100 million and $500,000. And this is where we come into play. Our Advanced Nanofabrication Unit, or ANU, is a new technology based on massively parallel direct laser writing. So it's a new technology not available at the market that combines the yield of commercial foundry services, but with a cost that's under $200,000. So this is the yield of commercial stepper systems, but with basically the cost and flexibility of your academic systems. So why are we doing this? We're doing this because our goal is to precisely help these innovative startups in-house their production by reducing their R&D cycle, increasing their yield, lowering their cost, and ultimately reducing their time to market. So where are we and what have we done so far? So the idea of making basically this type of system came in 2018. We started planning in 2019. We raised some money through basically a small grant. We started recruiting, and we are now in the middle of our very first prototype. So we have built our first prototype in the lab. Now, unfortunately, this is a lab prototype that is more meant for academic demonstration than actual, basically commercial activity. So what we need now is guidance on what this minimum viable product should be. When is it the right time to move from this kind of academic demonstration and start actively marketing? And more importantly, we're engineers. We spend a lot of time on engineering and perfecting our engineering design. So how much should we deviate from our engineering effort towards marketing, and what resources to allocate for that? This is where we believe we need the most help. And thank you for your attention.
All right. So that's a really interesting value proposition that you offer. Does anybody have any questions for Ahmad? All right.
Okay.
No? Okay. All right.
Okay.
Well, thank you
you
very much. I'll take that clicker back from you.